Welcome to my channel. In this video, I will discuss rheumatoid arthritis. So first we will introduce what is rheumatoid arthritis. It is an autoimmune disease that can cause not only joint pain but it also leads to damage throughout the body. So it is not only causing damage to the joints but also lead to damage to whole body. The joint damage that rheumatoid arthritis causes, it usually occurs on both sides of the body. So it is mostly a bilateral disease. And for example, if one of your arms or legs are affected, the same joint in the other arm or leg will probably be affected too. Here you can see pathophysiology. In this, we will start from here, that there is citrullination of the cellular proteins. These citrullinated proteins are presented by the antigen presenting cells to the T cells, and these T helper cells are activated, and these T helper cells activate the whole immune system, that is B cell activation and cytotoxic T cell activation can occur. But the main role is played by this B cell activation because these produce APCA antibodies, anti-citrullinated protein antibodies. Then immune complexes are formed, and when immune complexes are formed, then we know that when immune complexes are formed and are deposited in the joints, then inflammation occurs. So this is the pathophysiology of rheumatoid arthritis. The role is played by citrullinated proteins. There are stages of rheumatoid arthritis. In stage 1, the body mistakenly attacks in its own tissue, and in stage 2, the body makes the antibodies and joint starts swelling up. The antibodies are formed and joints start swelling up because of inflammation. In stage 3, the joints start becoming bent and deformed. The fingers become crooked. These misshapen joints can press on the nerves and can cause nerve pain as well. So the reason of severe pain is joints pressing on the nerves leading to pain. Here you can see degraded cartilage, swollen and inflamed synovial membrane, and bone erosion in case of rheumatoid arthritis. In stage 4, if rheumatoid arthritis is yet not treated, the disease will progress to the last stage, in which there is no joint remaining at all and the joint is essentially fused. So the joint cavity is fused in stage 4. Symptoms: pain or aching in one or more than one joint, stiffness in more than one joint, tenderness and swelling in the joint. The same symptoms on both sides of the body, as I told you that it is mostly a bilateral condition. Weight loss, fever, fatigue or tiredness and weakness. These symptoms occur because it is a general body condition, not limited to only the joints, but joints are most affected. Here you can see different causes of rheumatoid arthritis, like abnormal response of the immune system due to changes in hormones. Infections agents like bacteria or viruses can also trigger. It could be related to obesity, triggered by stressful events like physical or emotional trauma, and some environmental factors like smoking. Here you can see some major signs, that is boutonniere deformity of the thumb and ulnar deviation of metacarpophalangeal joints. Metacarpophalangeal joints are ulnar deviated, and swan neck deformity. Swan neck, here you can see swan neck deformity of the distal joints of the fingers. So these are one of the major signs of rheumatoid arthritis. Common diagnostic signs of rheumatoid arthritis are morning stiffness lasting longer than 30 minutes, swelling, tenderness, and decreased range of motion and warmth in one joint, low grade fevers, loss of appetite and fatigue, arthritis on both sides of the body, a bilateral condition, at least one positive blood test for what? For aqua, for anti-citrullinated protein antibodies. Arthritis affecting small joints in the hands, wrist or feet. Symptoms last for at least 6 weeks. Imaging scan shows signs of cartilage erosion and narrowing of the joint spaces. In this case, narrowing of the joint spaces occurs. What are the medicines that are used for the treatment of rheumatoid arthritis, or simply we can see what is the management of rheumatoid arthritis? We give corticosteroids such as prednisone. Why are these given? Because these suppress the immune system and therefore inflammation is reduced. Disease modifying anti-rheumatic drugs or DMARDs such as methotrexate, hydroxychloroquine ICQ, sulfasalazine and leflunomide, these can also be used. These are also immunosuppressants. Biologic DMARDs agents such as adalimumab, satralizumab, etanercept, golimumab and tocilizumab. These are antibodies that inhibit the immune attack, and therefore these are also immunosuppressants. And a relatively new class of drugs called Janus kinase inhibitors, JAK inhibitors, such as tofacitinib, baricitinib and obadasitinib, these are also used. So these are common medicines for rheumatoid arthritis. This is all about rheumatoid arthritis. Thank you for watching.